If you're an LVN student prepping for your exams, the NCLEX and ATI love testing about seizures because a wrong move can cause permanent brain damage. Let's decode the essential definitions, classifications, and safety interventions you must master. First, a seizure is a single isolated event caused by a sudden, excessive electrical discharge in the brain. Epilepsy, however, is a chronic neurological disorder diagnosed only after a patient experiences at least two unprovoked seizures. As a nurse, you need to know that certain medications, like atypical antipsychotics or opioids, can lower a patient's seizure threshold, making an episode much more likely. There are different types of seizures. Focal seizures originate in one specific area of the brain. If the patient remains conscious, it is a simple partial seizure. If their awareness is impaired or they become confused, it is complex partial. Generalized seizures involve both hemispheres of the brain simultaneously. Memorize the four types. Tonic-clonic features, a stiffening phase, followed by rhythmic jerking. Absence seizures are brief staring spells common in children. Myoclonic involves rapid, sudden jerks of the extremities. And a tonic, also known as drop attacks, causes a sudden, total loss of muscle tone, sending the patient straight to the floor. Clinically, seizures progress through three distinct phases. The prodrome phase brings early warning signs like headaches, mood shifts, or a sensory aura hours before the event. The ictal phase is the active seizure itself, where you may observe a loss of motor control, consciousness, or bowel and bladder function. The post-ictal phase is the recovery period, typically marked by extreme fatigue, confusion, and headache. Priority nursing interventions. Any active seizure lasting more than 5 minutes is a critical medical emergency called status epilepticus. Your first action is to notify the provider immediately. During the active ictal phase, your priority is safety and airway management. Gently turn the patient onto their side to allow oral secretions to drain and prevent aspiration. Place a soft pillow or folded blanket under their head and clear away sharp objects or tight furniture. Never restrain the patient's limbs and never force anything into their mouth. No tongue depressors, no barriers, and no fingers. Loosen restrictive clothing around the neck. Remove their eyeglasses and note the exact time of onset and duration. In the post-ictal phase, apply supplemental oxygen, utilize oral suctioning as needed, and perform a focused neurocheck to assess orientation. We also must reinforce lifelong medication compliance. Teach your client the absolute necessity of scheduled lab draws to monitor therapeutic blood levels of their antiepileptic drugs, whether they are broad spectrum like valproic acid or narrow spectrum like phenytoin. Keep your patient safe, protect the airway, document the timing, and you will absolutely ace your next exam. Good luck on your finals.